Hi, my name is Paige Stinson, and I did my experience presentation for this 419 class, and here it goes. My experience selection was a physical therapy clinic. I chose this scenery and this environment just because I know that I've always really wanted to work in an environment where I'm healing patients. I'm helping them with recovering. I'm helping them get back to functional daily tasks, out of pain, emotionally more happier. I really enjoy this experience just because I do really enjoy corrective exercise and the many ways that you can be creative about those exercises when conditioning the body to move again, feel strong, and be pain-free. This experience really excited me because there were so many different populations that I worked with. I worked with vagal and neural patients. I worked with just essentially older patients with just bad balance issues and not as much strength as they used to, as well as patients who had disabilities like Down syndrome, people who had post-op surgeries and fake like metal in them just because they had joint replacements. So it was really, really cool to get to experience different populations and see how corrective exercise and types of corrective exercise on a scale of how easy to how hard could vary depending on the population that we work on. The requirements as far as front desk, I welcomed and I said goodbye to guests or patients. I checked people in. I asked new patients for their IDs and their insurance cards, and I read them all of their co-pays and their insurance and their deductibles. And then I also scheduled, kind of did all of just like the regular like scanning and scanning like important documents, and then scanning in like progress notes or evals, just anything that the PTs will bring back to the front desk. I've answered phone calls, I've taken messages, all that fun stuff, as well as clinic cleanliness. I did the laundry. I picked up after the PTs, so whenever they needed me to go and grab something or whenever I need to go put something away, I would typically do that. I would keep the equipment clean, the tables clean after the patients were done on the tables. I would do all of the chairs outside in the waiting room, I would clean those, just keep everything clean and professional looking and organized so that the patients would come in, and especially with balance and like neural patients, it just make it easier for them to not have an accident or just keep the professional of the clinic super good. As well as patient care, I was required to relay information from the PT to the patient. Again, like I said, I worked with a bunch of different populations. I was able to work with a couple of Down syndrome patients. That was super fun. The way we did functional tasks and PT with them was like just the most fun and creative way that I've ever seen physical therapy done. It was super cool to work with post-op patients. I really got to figure out how to be a leader and how to understand what the PT wanted from me as far as relaying information. I really, really, really had to be able to connect what I was learning back at school in the physical therapy setting like this super quick. That way I could give the patients what they needed in the best time of care under their 1 hour that they had here. Again, just helping patients, helping the PT, the flow of the clinic, all of that fun stuff. They also have pool therapy, so also with like clinic cleanliness, I also would help keep the clinic, the pool clean with the pH and the chlorine and then all of that fun stuff. My SMART goals that I had done, the first one for overall knowledge, I had hoped to learn more about the areas that I just overall needed to really work on. So that could be like confidence, just like overall knowledge and experience of being in a professional environment like that. Being able, obviously I learned here at school, but can I apply those things to the workplace and to the setting with a stressful situation or a stressful flow of just a lot of patients being seen at the same time, or just having to meet the standard of a director. And that was pretty difficult. It was hard trying to relay information to the patients. I had a lot of confidence issues, but overall what I really wanted to learn was how to be a leader and to remind myself how to instill my core values and remember what I was here for, which was the experience. Professional knowledge, I specifically hope that I had gained more assertiveness when it comes to like emotional intelligence and like knowing and understanding and basically perceiving how a patient may be feeling in that moment. A lot of people who are in pain typically don't like you'll know when they're in pain, but then a lot of them, you'll want to be assertive and know, as far as giving plan of care, what and what type of severity and what scale of intensity, how you should give it to them. So that, I think, as far as like knowledge of like post-op and surgery and all that fun stuff, connecting the dots with that, I really wanted to learn. And then general skills, I also helped to go through just job experience, and then like with the rest of my degrees, with my master's later on, I hope to become a better leader and have a voice and have more knowledge. And then as well as like my ultimate career goal, I just really want to be an impact or make an impact on somebody someday, hopefully, be able to emotionally guide someone and physically guide someone to their dreams of whatever that may be, and whatever professional career I choose to go in, or what population that I'm with, just to hopefully just be that support system and remind them who they are and that they can go a long way. Just remember that to never give up on themselves. Progress, honestly, I think I had a really good experience. I did have a lot of downfalls, a lot more than I thought I would, but I definitely think that I had to go through those downfalls and those failures and make those mistakes. I have worked in a couple PT clinics before, but I have never worked in a setting like this. I would say hard, just because this is my first time actually working hands-on with patients. So that was super challenging. I'm not a super confident person, so this experience really kind of showed me that it's not even just for myself to have my personality out on the floor more and have my confidence out on the floor more. It's also for the patient's security and knowing that they can trust you as someone that they can go to for patient care. So definitely one of my biggest takeaways was being more confident and like knowing that I can do this, and that I'm not just here to, have this career, but it's also like I do want to help people, I do want to take care of people, and that qualifies me for this profession, just working in healthcare. And then I also just wanted to be able to recognize, again, like I said in my last slide, when someone needed help. That's my biggest thing. I want to be a leader in someone's life. I want to be able to help them. And I think this biggest takeaway, I think I'm very good at like understanding emotions, and I just want to help people, and so I have a passion for helping others, and I had really hoped that I could be able to just learn more about how to be emotionally assertive, especially because in healthcare there's a lot of people that come to you for help. And I think that this was a super good experience for me, just to put myself out there, and then remind myself like the whole education to connection experience. It's going to be hard, but I need these experiences to learn more and hopefully be the best at what I can do in the future in my career. My learning experience, I honestly overall kind of like went over this already. Just learned professionalism. I learned how to take care of patients, how to greet patients, have fun. I worked with a lot of Down syndrome patients and a lot of neural patients, so we would do, like in this picture that you see here, we would do some balancing, like kind of courses like that, and then we would also do like scavenger hunts with this one patient who had a favorite character in a movie, and she would go and walk around with a weight in her hand, and go and find those pictures. So that was super fun. It was just, my biggest takeaway was that nothing has to be linear in healthcare. You can always find something, whether you don't have that equipment or whether this is, your first patient or client with this condition. You can always find something to help with that condition. And then obviously, if they have a disability, like obviously keep it fun. I've worked with babies and toddlers. That was super fun. Keeping it fun and keeping them engaged is one of the biggest takeaways I also had from this experience. People are going to progress more when they enjoy their therapy. So that was also one thing that I learned more as well. And then also, like, again, with the little balancing course, that was super fun because we did that for all ages, and it was honestly super cool to see the progression in a lot of people. And then my career application, I hope someday that I remember how I can be a leader in someone's life. I hope to be more confident in myself. I think that as I go through more experiences in this career, I definitely will feel a little bit more confident and a little bit more solidified in who I am as I gain more knowledge as well. But I think this was a great first experience to gain more knowledge on how to work with patients and just the professionalism and the flow of the clinic. And I really am super grateful for this opportunity and experience. Thank you and have a great summer.